COVID-19 media briefing for Wednesday, May 27th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen and Toronto Fire Chief and General Manager of the Emergency Operations Centre, Matthew Pegg. Mr. Mayor.
Well, thank you, Brad, and good afternoon. COVID-19 is the greatest threat that our city has faced in this generation. It continues to take lives, and we know that it is present across our city. No person, young or old, is immune. No neighborhood is immune. And of course, it poses other threats to our residents as well beyond health, their employment, their financial state, even their state of mental well-being. Throughout this pandemic, I, together with all the other members of the team, have worked tirelessly to honestly assess the situations we have faced and to reflect those honest assessments in my comments to the people of Toronto and, to the greatest extent possible, share the information that we have. I am in favor of doing everything possible to stop the spread of the COVID-19 virus. Today, Dr. Davila and Toronto Public Health will be releasing geographic information on COVID-19 cases in our city. It was information that I requested she bring forward as part of a presentation in general terms on the basis that it would help us to fight the spread of the virus and, just as importantly, to support neighborhoods and people affected by the virus. This is about human beings who have tested positive, fellow Torontonians who live with us in our city and who live in areas that have been affected more so perhaps than others. I believe this information, releasing it to the public, will do far more help than it will do harm. It is a reminder that COVID-19 is here and that we must be vigilant in following public health advice. It is a reminder that we must focus on supporting people affected by this terrible illness, not shy away from that in any way whatsoever. It will help us to make better decisions and to do more to help where that help is going to do the most good. And I hope it will encourage people, if they have even one symptom of COVID-19, to get tested. I want to thank Public Health and Dr. Davila for making this information public, and I look forward to Dr. Davila sharing more details of her report with you this afternoon. I'm proud to announce today that the City of Toronto has received authorization from the Province of Ontario to open an 8th licensed childcare centre to provide care for the children of essential and critical service workers. Like the first 7 centres, this new one is in an existing city-run licensed childcare facility and staffed by our excellent City of Toronto childcare workers. The additional childcare centre is now open and is located at Blake Street Early Learning and Childcare Centre, 84 Blake Street, in the community of East York. Emergency childcare services are reserved exclusively for the children of essential and critical service workers identified in the Province of Ontario's list of workers eligible for emergency childcare who have no other alternatives. While we know the safest option for families is to have children remain at home during this time, if possible, many families don't have the option of doing that. These city-run centres are funded by the Province of Ontario so that licensed childcare service is available at no cost to qualifying families for children under the age of 12. It is an example of how we are working together, governments working together, to help people and to address issues during this pandemic. Since launching the online application form on March 28th, the City has received more than 1,128 applications, has contacted and offered a placement to 757 families, and has placed more than 342 children in care. 67% of the applications were from healthcare-related workers, including Toronto Public Health and long-term care, and our first responders. Because physical distancing is more difficult when caring for young children, as many of you out there will know, additional measures are being taken in consultation with Toronto Public Health and Occupational Health and Safety to maintain a healthy and safe environment in these emergency childcare centres. We have a number of precautions in place, including daily screening of children and staff, increased disinfection, reduced group sizes, limiting the number of people in the centres, and use of surgical masks when 2-metre distance cannot be maintained. Children's Services continues to work with Toronto Public Health for ongoing reviews of all of the emergency childcare centres. These centres will help us to have a roadmap for childcare as we move into restart and recovery. This is a very difficult issue and a massive challenge. I continue to be impressed with how quickly our city staff worked with our provincial partners to implement and expand emergency childcare service for individuals doing vital work during this pandemic. The infection prevention protocols we have in place in our emergency childcare centres not only protect children, their families and staff, but they will help us in the future when we are ready to open up our entire childcare sector and system again. As we continue to fight COVID-19, we are continuing to provide vital city services, as we have throughout. I am proud of the work that our essential city workers are doing each and every day during this pandemic so that people have the services they need. And we are gradually bringing back more city services, provided that we can do it in a safe way that does not in any way compromise public health. As part of our ongoing phased approach to resuming services, 311 will now begin taking requests for waste bin exchanges. This sounds like a small matter to raise, but I know it has affected many people over the last number of weeks when they have been unable to get the help they need to replace a waste bin that has been damaged in some way. This is something that was indeed suspended as a part of the city's response to the COVID-19 pandemic so that we could devote our resources to the areas where they were urgently required. Requests to upsize or downsize a recycling or garbage bin can now be made once again by calling 311. Sorry, I've got some duplication of my remarks here. I'll just flip ahead here. Today, I'm also pleased to announce that starting Monday, June the 1st, all drop-off depots will reopen to the public. Again, the opening hours, originally these were closed, and then the opening hours were phased back in some of the locations. We're now going to fully reopen those, all of them, to the public. They will all operate under regular hours with the exceptions of the Bermondsey and Ingram drop-off depots, which will keep the weeknight and Saturday hours only. All locations will accept the regular list of materials, including hazardous household waste. Compost pickup will not be available at any drop-off depot. During the initial limited reopening of the depots, we've seen large volumes of visitors and thus longer wait times. And I want to thank people for their patience, but at the same time, ask them if they will limit their visits to the drop-off centres and depots to respect public health guidelines and help us to deal with the backlog that has arisen. A payment must be made by debit or credit. Cash will not be accepted. A face mask or covering is recommended when one is unable to maintain a 2-meter or 6-foot distance from others. And at drop-off depots, this includes interacting with staff at weigh scales or dropping off hazardous household waste. So please, when you are there visiting these depots, wear a face covering or a face mask. I should also give an update on the Toronto Islands and a brief confirmation on some activities being undertaken in Trinity Bellwoods Park. As you know, due to federal regulations requiring half-capacity loads and other restrictions for the island ferries, as well as public health advice regarding crowding on amenities at Toronto Island Park, those amenities remain closed, and there is no public ferry access to the park directly. City staff are working on alternate plans to be able to open up public ferry access and access to amenities when conditions change so that we are ready to move quickly when we get the appropriate public health advice and the appropriate relief from current federal regulations. I know this can be frustrating for people who want to visit the islands, but we have to go about these things in a safe and orderly way. Our continuing approach is that of a measured reopening, whereby we opening things like the island as quickly as possible and as quickly as is advisable, but not too quickly, always mindful of the overriding concern we must have for public health. On Trinity Bellwoods Park, in addition to the monitoring and compliance activity that Chief Pegg will refer to in his report for today, I should tell you that park staff will be in Trinity Bellwoods Park tomorrow painting circles on the grass of that park, which will both help to illustrate proper physical distancing and help with the measurements, but also help to ensure compliance in a place where we simply have to do better. Now it is time to call on Dr. Davila for her report for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 152 new COVID-19 infections in Toronto. To date, 7,814 people have recovered, an increase of 187 from yesterday. For more detailed data on the status of COVID-19 cases in Toronto, please visit our website. A critical function of public health is to gather and analyze data to understand how any infectious disease, including COVID-19, is spreading and impacting our residents and our city. This information, which is gathered as part of the case and contact management process, is fundamental to all of us in public health, as it informs our strategy to protect your health and helps us to determine when we need to adjust our actions. I continue to receive a number of questions regarding our data and what analyses my team is doing. Earlier this month, I shared the results of an analysis with you that focused on the socioeconomic characteristics of those areas in our city that have the highest COVID-19 infections and hospitalizations. These data are published on our website. Another issue we have been investigating is whether COVID-19 is impacting certain neighborhoods in our city more than others. To this end, we have created maps of cases according to where they live. Initially, people acquired the COVID-19 virus through travel when it first appeared in our city back in January. Since this time, we have continued to see community spread. Our data confirm that COVID-19 is present in every single neighborhood in Toronto. At this time, based on the last 2 weeks of activity, our mapping indicates that people living in the northwest and the northeast parts of the city now have the highest number of positive cases. Interactive COVID-19 maps by neighborhood are now available on our website. However, it is important to note some key considerations. First, where a person lives does not necessarily indicate where they picked up COVID-19. The reality is that you are at risk of getting COVID-19 anywhere when you are in close contact with the respiratory droplets of someone who is infected with the virus. Second, looking at a map of cases, people may mistakenly believe that there is an elevated risk of infection by going to certain parts of the city. This in turn contributes to misinformation and unintended stigma. We all have a shared responsibility to not create unnecessary social, physical, or other harms in our community. I've said this many times before, but I think it is important to remind ourselves once again that these cases are our friends, they are our colleagues, and they are our family members. These numbers represent people, people in our city. It is important to keep in mind that these maps reflect where people live, and they do not necessarily reflect where they were exposed to the virus. Areas with lower rates of COVID-19 cases are not inherently safer from a COVID-19 perspective. For us in public health, by knowing where those impacted by COVID-19 live and by assessing other important risk factors, we are better able to inform our preventive actions. We can better identify where proactive testing might be helpful, and we can take action, targeted action, to reduce virus spread. I'm pleased to share that my team has published these maps online today. Going forward, we will continue to update this information with the other data we publish on our website. On another data topic, while our COVID-19 case counts are critical to helping us understand virus spread in our city, these numbers are influenced by how much testing is done. Data on hospitalizations, however, provides a more stable indicator of severe illness and of our health system's capacity. The good news here is that overall, we have kept hospitalizations and ICU admissions low compared to other jurisdictions who have been severely impacted by COVID-19. This is in part attributable to the implementation of public health measures early in our outbreak when our case count was still low. It is also due to all of the hospital and health system preparatory work completed earlier this year based on the experiences of other jurisdictions. One of our objectives at the beginning of our COVID-19 response was to ensure that we protected our health system so that it could respond effectively to all patients, whether for COVID-19 or for other urgent medical needs. So far, we have been successful in achieving that goal. And finally, I have also talked before about the importance of the COVID-19 reproduction number as a good measure to help us understand how well the outbreak is going and how well it is being controlled and a way to track progress. Our goal is to bring down the reproduction number to less than 1. This means that each existing infection causes less than 1 new infection. In this circumstance, disease activity declines and virus spread eventually stops. Prior to implementing our strict public health measures in mid-March, each new case of COVID-19 in Toronto went on to infect an average of just over 3 other people. This contributed to the growth of the outbreak and the rise in our curve. Public health measures, including physical distancing and isolating cases, have helped us to reduce the average number of people each case infects. As a result, our current reproduction number in the community is 1.1. But remember, we want to get this number below 1. And this means we must continue our public health measures for now. This means washing your hands frequently, practicing physical distancing, staying within your household bubble, essentially following all the advice we have provided over the past several weeks. Our collective hard work will pay off, and we will safely reopen our city, but we all have to keep doing our part. So please, continue to practice physical distancing at all times, and please continue to take care of each other. I'll now hand it over to Chief Pegg for his remarks.
Thank you, Dr. Davila, and good afternoon. As a city, we continue to provide the essential and critical services that our residents both need and rely on each and every day in Toronto. Our Emergency Operations Centre continues to operate, ensuring that both critical and essential services are being provided without interruption. I am proud of every member of our City of Toronto team who continues to work hard in support of our residents each day. This is the 78th day of continuous Emergency Operation Centre activity. At present, our personal protective equipment levels remain stable, and our team continues to work hard to source the equipment we need on a go-forward basis. Our current PPE inventory levels are as follows: a 27-day supply of N95 respirators, a 247-day supply of surgical masks, a 228-day supply of isolation gowns, and a 44-day supply of face shields. Our pandemic reserve stockpile, which is in addition to the current inventory I outlined previously, is as follows: a 235-day supply of N95 respirators and a 55-day supply of surgical masks. I'm pleased to advise that the active TO program is ongoing. Overall, the feedback we've received about the active TO program and the associated closures has been very positive to date. The Gardiner Expressway will be fully closed for maintenance this weekend, beginning Friday at 11 p.m. until Monday at 5 a.m. Accordingly, the associated segment of Lakeshore Boulevard will remain open for vehicles and will not be part of the active TO program closures this weekend. The following major road closures will be in effect from Saturday, May 30 at 6 a.m. until Sunday, May 31st at 11 p.m. as part of the active TO program. The eastbound lanes of Lakeshore Boulevard from Coxwell Avenue to Q Beach Avenue. Bayview Avenue from Mill Street to Rosedale Valley Road, and River Street from Gerrard Street East to Bayview Avenue. Heading into this upcoming weekend, it is important to note our enforcement efforts relating to the ongoing public health orders will continue. This will include a strong enforcement presence in Trinity Bellwoods Park, in our waterfront parks, and various other parks across the city this weekend. Our enforcement team will be present at Trinity Bellwoods Park to greet park users, to remind them about the importance of physical distancing, and to take enforcement action as required. In closing, I want to thank everyone who continues to do their part to help us stop the spread of COVID-19. As always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto, and for more information on active TO initiatives, we encourage you to visit toronto.ca/active-TO. Thank you.
Okay, thank you, Chief. Just before we get going, staff that are on the line for any questions reporters may have include Mary Ann Bedard from Shelter Support and Housing, Janie Romoff from Parks, Forestry and Recreation, and Paul Raftis from Senior Services and Long-Term Care. First question is to Brian Passafume from the Toronto Sun. Go ahead, Brian.
Good afternoon, everybody. I just got one question today for Mary Ann Bedard. What's the status of the St. Felix Center expansion into the new location of the Esplanade? Do you have any information on that?
Thank you, Brian, for the question. Yes, we're making really good progress in creating physical distancing in the shelter system. As of today, we've been successful in moving 2,919 people, which includes more than 1,400 people that have moved into hotels. We are looking at a site on the Esplanade to rent for a short period of time to provide some physical distancing for one of our shelter sites, for one of our respite sites, sorry.
Okay, and you're not able to confirm if that's specifically for St. Felix, or is it for other respite locations as well?
In general, Brian, we don't share a lot of details for the privacy of the clients at the programs.
Okay, thank you. Next question is to Mark McAllister from City News. Mark?
This question could be to both Dr. Davila and Mayor Tory with regards to the new data and the mapping out of the cases in the city. Is there going to be something as a result of that in terms of more education in certain parts of the city, or different approaches to target the people that are living in those particular areas?
So I'll take that question. Thank you. I think that's exactly what we try to do with our data. It is precisely for this reason. We look at data to try to inform and enhance our response. So the kinds of things we could be doing are exactly as you suggest, perhaps some education and concerted preventive efforts to help support the residents in that community. The possibility of proactive testing in certain neighborhoods is another one that comes to mind in order to provide access for those who have symptoms of COVID-19 or have been exposed to other individuals with COVID-19. Those are just a few examples. We certainly don't restrict ourselves to what actions we might take, and in fact, we let the data lead us to what the appropriate actions will be, and of course, the science in respect of COVID-19 and its spread.
Mayor Tory, if you could chime in and just offer us, obviously you want to defer to your medical officer of health, but were you surprised in any way by some of this data as it's been mapped out?
No, I wasn't particularly surprised, but again, at the end of the day, the data is the data. What I think is more important than the data itself is what you do with it. And I think this represents a huge opportunity for us to support people better, to help educate people better, any of the requirements that might exist to help stop the spread of this virus, and to help make sure that all of the people of Toronto understand what we can do collectively to make sure that it stops spreading everywhere, but particularly in places where we've seen a disproportionate number of cases that reside in those areas.
Okay, thank you. Go now to Matt Bingley from Global News. Matt?
Hi, good afternoon. I'm just wondering, where we see the city has continued to be more affected and urban areas are more affected, I'm just wondering if when the province gets to phase 2 of opening up and you're still seeing that the city is not at that level, is it within your power to say, no, we're going to stick with phase 1, or is that even something that you would consider?
We've had a very collaborative approach with the Government of Ontario, but I have certainly in my discussions with the Premier and ministers of the government made sure that they understand, as I believe they do, that the city is different because of its size, because of the way its population is set up in a more dense kind of circumstance, just because of the scale of just about everything from our public transit system through to the number of soccer fields we have. And so I'm very hopeful that, and I'm optimistic that if there is required an approach that takes more into account the needs of, say, the GTA or the City of Toronto, that is based on the advice of our medical officer of health, based on our facts and our particular circumstances, that the province would be willing to take that into account. And as I say, from my perspective, in terms of my discussions with the political leaders, they have been very open to listening to what I have to say in terms of timing, in terms of the time allowed for us to make some of the changes that have to be made in these different areas as we reopen, because I think they understand that Toronto and the GTA are different. With respect to the health part of that, perhaps I could ask Dr. Davila that she might comment for you in that regard.
Yes, so with respect to the health aspects, the way I look at this, it's like any other medical care or health care intervention. There are standard approaches with respect to how patients with different conditions are managed. But each patient is their own unique individual, and they will go through those steps. Their recovery path, their path of illness and their path to recovery is unique to each individual. We understand that from individual medical care. That's actually not that different from public health practice, except we're dealing with populations or cities or towns. Each jurisdiction, each municipality has its own unique characteristics, just like each individual patient does. So we are following the provincial framework that has been laid out in respect of reopening. It has some very good dimensions to it. It talks about virus containment and spread, healthcare capacity, public health capacity, and incidence tracking, surveillance and incidence tracking of the virus, which are all important dimensions to determine whether we're prepared to move to the next phase. These are the very same measures that we will use to determine what makes sense for Toronto, and I expect that those are the same dimensions that will be used across the province. However, each one of us will hit different points in our own way, in our own timing, and I think that is exactly what is anticipated as part of the provincial framework.
And I'm curious, when it came to phase 1, Mayor Tory, you said that you were not involved in knowing what the criteria required was for that, and that you wanted to be more involved when it came to phase 2. Is the province including you more based on that critique?
Well, the issue here isn't including me. It is including the medical and health, public health experts that represent the City of Toronto, and I'm very pleased to say, and I commend them for cooperating with us and with all of the medical officers of health across the province of Ontario who have shared their collective professional expertise with respect to the kinds of things that might be looked at as a means of setting the timing for moving into, for example, stage 2. And so I hope that that expertise, and I'm quite confident it will be, very carefully considered. And I'm very hopeful that the province will as well provide to us and to other parts of the province, by us I mean the GTA and the City of Toronto, the flexibility that probably is implied by what the professional health experts say about how every patient is different. By that same token, so is every community going to be different in terms of both its response to the virus and in the staging of the reopening of that community, dependent upon their own numbers and circumstances.
Okay, thank you. We go now to Mitu Matahar from CTV News. Go ahead.
Hi, good afternoon. My question is for Mayor Tory. I wanted to ask, when are rec centers and pools across the city expected to open?
Well, I think this is all part of the very same set of considerations we were just discussing. These are places by definition that cause people to come together, and it's a wonderful thing about community centers and rec centers is that large numbers of people from neighborhoods can enjoy them together, and their children and families and so on. But it has to be done at a time when it is going to be posing much less risk to public health than was the case when they were closed. And so I can only assure you that as part of the staging of the reopening of the city, that we're working hand in glove with the province to make sure that we don't have a complete patchwork quilt. There will be differences from time to time, but also making our own independent decisions based on the advice of our medical officer of health about these things that I get asked about often, swimming pools, recreation centers, and other places of communal fun activities that people enjoy, and we want them to enjoy as soon as possible.
Thank you.
Okay, thank you. We'll go now to Francine Copen from the Toronto Star. Francine?
Question is for Mayor Tory. You mentioned, Mayor Tory, that you weren't surprised at the data that shows some neighborhoods have been harder hit than others by COVID-19 infections. Why weren't you surprised?
Well, I'm extrapolating to some extent, and I think certainly I'm interested in seeing us dig into this data as much as we can in order to see different ways in which we can respond by helping and supporting people. But I think if you look to some extent at the socioeconomic characteristics of some of those neighborhoods, the kinds of work settings in which people work, the accommodations that they often live in, sometimes many members of a family together, it provides, and I'm not the health expert, I rely on obviously our good doctor and her colleagues to do this, but it provides more of an opportunity for the virus to spread inside those households than might otherwise be the case, and for it to be brought back to those households from the working circumstances and other ways in which those people live their lives. And so I think the objective now has to be to take the opportunity presented by the data to provide even more support for the people who live in those neighborhoods and to provide more education and all the things Dr. DeVille has talked about so that we can use this as an opportunity to make sure that we do as much good in those neighborhoods as possible where that good is required.
My next question is for Dr. DeVille and Mayor Tory. You've both touched on some of the things that you'd like to do to address this issue, including education. I'm wondering if you could expand a little bit on that, and do you have a timeline for this? When are you going to start helping these neighborhoods?
Well, perhaps I'll start off with my comments and say that, of course, we'd like to try to help people as soon as possible. That's the purpose of actually collecting the data and conducting these analyses. It is to inform our response. And yes, it may be about bringing more of the existing services. Sometimes it's around providing the services in a more resonant way. So, for example, testing for COVID-19 and advice on when to seek testing has been consistently provided throughout the COVID-19 response. But if we are able to identify certain areas where perhaps testing might be more beneficial or where a greater amount of testing needs to be done, we can bring testing in partnership with healthcare providers so that people might be able to access that. We can also provide education and information on how to reduce spread things like perhaps information on masks and how to acquire those and how to make your own. There are all sorts of interventions that might be amenable to public health intervention. But I would emphasize that this is one set of, or one method by which we are analyzing our data. It needs to be looked at in its totality so that we can actually understand the full set of circumstances, how people acquire the disease, and how they go on to transmit. These are two important elements in which public health action needs to be provided and put forward.
Just looking beyond the comments that Dr. Davila made, I was interested, for example, in the fact that in the community spread category of the data that we saw today, that there were so many young people who were affected by the virus and who had contracted this virus, and that maybe suggests an educational task that's in front of us that is different than if it was, for example, people who are of a different age group. And I think there's a wealth of information that comes from this, but I would say that in terms of the help that is being provided, I think we have been doing so with regard to food security. The other governments have helped a lot with income support, and I think there are a variety of things like that we're already doing, but I think the data gives us, as I said, the opportunity to look and see whether it's education or other kinds of supports that we can offer in those neighborhoods, whatever it takes, to make sure that we do whatever we can to stop the spread of this virus and to try to eliminate or reduce circumstances in which the spread can be happening in those areas.
Okay, thank you. We'll go now to Haley Cooper from News Talk 1010. Haley?
Thank you. Mayor Tory and Dr. Davila, you've cautioned against people looking at the map and stigmatizing neighborhoods. But are there any concerns about what this will do to businesses in neighborhoods that have been hardest hit, that are in the process of reopening or getting ready to reopen? Because I'm sure some business owners in these neighborhoods are going to be even more worried about recovering.
You know, the expertise in this rests with Dr. Davila, but both of us have said, and I rely on her and all the other people who have said, that if the proper precautions are taken with regard to physical distancing and with regard to face coverings and common sense, things like that, that we've advised throughout, that you're going to find this virus in every single neighborhood in the city, every single socioeconomic group without exception. And so I would hope that if people follow the basic advice they have been given repeatedly by our public health officials at all levels, but including our own doctor here, that those businesses can reopen and recover, patronized by people who normally would patronize them, as long as precautions are taken to ensure, as they would in any part of the city, the rules and the recommendations and the advice that are given across the city and not to particular neighborhoods.
That's right. I almost can't add anything further to that. Clearly, the mayor has been listening to the advice. It is absolutely, rests on following the precautions, physical distancing, hand washing. Certainly for those individuals who are supposed to be isolating or who are sick, to avoid going out and to seek testing if you actually have symptoms of COVID-19. These are all the elements that need to be in place and followed that will allow us to, one, reduce virus spread in our city, and two, get back to reopening and restarting all the regular activities that we would like to see back in our city. It comes down to that.
Your follow-up, Haley?
Okay, and my follow-up, Mayor Tory, you mentioned that there was going to be some sort of announcement regarding expanded patios. And we're just wondering if that announcement is coming this week.
I hope it's coming very soon, because we want to move from a stage where we've received a lot of input with respect to where people would like to see this happen. We've applied then the professional expertise of our public servants to, where it can technically be done, and then we'd like to get on with actually picking places it can be done so that those patios can be open and the people can not only enjoy what I believe will be an improved quality of life in those neighborhoods, but also the restaurants and bar owners can be the beneficiaries. Let's remember those restaurants and bars are not yet open and will likely be part of the next stage of reopening, so that while I'm not trying to say we're going to drag our feet on this in any way, we have the time to get this right, which is what we want to do. And so I would expect it'll be soon, but I don't want to name a specific date and then not deliver on those expectations. But we're working hard on it, and the staff have been very devoted to it, and I hope it's going to make a positive difference in our communities and to the businesses that will benefit from it.
Okay, thank you. We now go to Dave Nickel from Metroland. Dave, go ahead.
Hi,
This is for Mayor Tory and Dr. Davila. Speaking of the data that you come up with today, it seems as though one of the things that this data has really identified is two Torontos. One with people who have the means to physically isolate when they have to wear masks, to do something simple like ordering groceries. The two parts of the city that are that are experiencing the largest number of cases are places where there is high density housing. A great deal more poverty. People may not have the means to do things such as shelter in place, work from home. How much can good communication do on this when you have forms of housing and levels of poverty that make physical isolation almost impossible for people?
Well, I'll start off again dealing with the public policy as opposed to the public health aspect of this, and simply to say that it was a reality before the pandemic, and it'll be a reality that we're trying to address as aggressively as we can through things like our poverty reduction strategy after the pandemic, that we have people in different parts of the city that are living in very different circumstances. I would say there has been no issue that has received more attention, and properly so, during the pandemic than to make sure that we provide whatever supports we can. And that includes the kind of income supports provided by the other governments. It includes attention that we have tried to pay to food security and other such issues. There's been no issue that's received more attention than making sure that people who are more vulnerable or more at risk from the standpoint of not being able to make some of the accommodations that you suggested, such as staying home from work easily or other kinds of things like that, that they are looked after. And this data will simply reinforce our desire to do whatever we can, and I will rely in part on public health advice and in part on just good, solid common sense and public policy to take measures that can try and help those people. We're not necessarily, going to be in reality able to move them from their current housing during the course of the pandemic, but we can find ways to improve the circumstances in which they and their children and family members live, and to provide the education. Yes, that is very important, so that it can help them as an opportunity here to work with us to limit the spread of the virus. But we are very focused on, as a city, and have been for some time now, before and after the pandemic and during, helping those who need more help and who need more support from their city government and from the other governments.
So I think the addition I would make to that is that it is well established in public health practice that things such as income, housing, and employment are important social determinants of health. And given that in public health our objectives are to improve health status and reduce disparities in health status, these are important considerations for us. So what we've described thus far around the activities that we might engage in right now in respect of controlling COVID-19 are the short-term actions. But you're quite right. I think there are longer-term actions that are necessary, many of which are in the policy arena, in order to address issues around income, housing, and employment. These are important elements to address if we are to improve health status in our city and to reduce disparities in our city, and overall to become the healthiest city we can be. Fundamental to public health practice. So those are certainly on our mind. They are longer term goals for us as public health, but that doesn't make them any less important to us.
Okay. As a follow-up, the other thing that's notable about these two parts of the city is that they're very distant from the city core, and combined with poverty, many people there would no doubt have to be taking public transit more so than others, simply to go about their daily lives. Do you have any indication that this aspect has increased this, or is this part of something that you're going to be looking into?
Well, can I start off by saying that if you look at the entirety of our public transit expansion program, if you look at the significantly increased levels of operating support extended to the transit system, you will find that that has been to extend transit system even during the pandemic into the areas where people rely on it to a greater extent. And the expansion program has been to supply transit or provide transit to areas where they have been without higher order transit for a long, long time, decades. so that those parts of the city are connected up to the city as a whole, which provides for a greater opportunity for people getting jobs, getting better jobs, which is, as Dr. Davila has said, one of the things that will help determine their health, the quality of their housing, and their ability to provide support for themselves and for their families. And so I would say every single aspect of public policy in the city, transit policy, policy with respect to other kinds of social assistance programs that are in the city's domain, have been put together and funded on the basis of helping where that help is most needed. And that will continue to be the case during the pandemic, as it has been in partnership with groups like the United Way and the Red Cross and others. And it will continue to be the case in terms of our own public policy efforts. A huge affordable housing program, the biggest I think the city's ever had in total. And again, it is directed to those areas of the city and to the people who are most in need, who we need and want to live comfortably with fellow Torontonians, and we're doing something about it, and we will continue to devote ourselves to it. We made an announcement on housing now about that yesterday, and we will continue to do so going forward.
Okay, thank you. Next question is to Derek Dionarain from CBC News. Derek?
Brad. So this first question is for Dr. Davila. Are you in any way worried that arming people with this information, as far as the data that you guys just released for neighborhoods, could lead to complacency if in a low outbreak neighborhood, or having people from hotspot neighborhoods go to low outbreak areas because it's perceived as safer, but then end up bringing the virus there? Are you concerned about any of that?
Well, I think that we're always concerned about ensuring that data are appropriately used and interpreted, because, again, it's very important that people understand the context of data. It is too easy to engage in sort of propagation of misinformation, and that would be entirely inappropriate. That's why we've tried to emphasize that, look, there is actually COVID-19 in every part of the city, and what's most relevant is that the risk for COVID-19 exists when you come into close contact with a person who actually has the infection. And of course, as we know now, having learned more and more about this virus since it was first discovered in January, that there is such a thing, and it's not infrequent to have asymptomatic infections. Hence, to my mind, while this is important to us, the data can inform all of us as a community and inform us as public health practitioners. To my mind, what's most important is ensuring that people are practicing good physical distancing, good hand hygiene, and following all the good public health advice that we've been providing in order to minimize risk.
And just to follow up, this question is for Mayor Tory. Obviously, the weather is great and people are heading out to, try to find some sort of relief towards that. And someone had touched on swimming pools earlier. What's your recommendation for people who may be going to beaches? And will the city be doing the blue flag water testing at those beaches as well?
Well, we do the water testing all the time, pandemic or not, because that is part of our obligation. It's part of our membership in the Blue Flag program in order to maintain the water quality and the quality of our beaches, so that that is an important element of public health and public safety as well, is to make sure the quality of the water is as it should be. So that water testing will continue, and my information is that we will have appropriate people from the enforcement branches of the government on the beaches in the coming days, and including over the weekend, to again remind people of what the physical distancing requirements and advice is, and to hopefully make sure that that is being complied with.
Okay, thank you. Next question is to Jeff Gray from the Globe and Mail. Jeff?
Thank you. Hi, everybody. I wanted to direct a question to Dr. Davila just about this proposal from the local medical officers of health to the province. Am I right that what I'm seeing there is the 34 medical officers of health saying, province, we need more specific criteria that we can measure whether or not we're going to open the province further. There's a whole list of things in there that I hadn't seen in the province's published criteria. And then connected to that, why don't we break it down by region? Because obviously Toronto and other places are getting hit harder. Have I interpreted that correctly?
So you're quite right that there was a proposal put forward by the 34 local medical officers of health around the province. And when you look at it, it was a set of indicators building upon the existing provincial framework for reopening the province. So it did it added a higher level of specificity, demarcating specific indicators and actually providing rationale for those indicators so that it can be used as a public communication tool to help our communities understand why we're looking at certain aspects, what we expect to get from following those particular indicators, and what it tells us about our readiness as communities all around the province in terms of reopening or relaxing public health measures. That's really what that was all about. And it was done certainly within the spirit of collaboration. That's why it was done as a build upon or as an addition following the provincial framework for reopening the province and relaxing public health measures.
And just as a follow-up then, are there any concerns if this was to go ahead and we were to allow, say, Toronto or the GTA, Ottawa, Windsor, these places to stay in more of a locked down situation while the rest of the province opens up? Is there a danger that that will just confuse the public health message? You'll have people seeing the Premier talking about the whole province opening industry X, but Toronto will be keeping it shut. I mean, are there dangers that that'll just confuse the message?
Well, I think communications is always a challenge, particularly in a rapidly evolving situation, and certainly in a situation where we are seeing differential impacts across the province. However, there is a consistent approach. I do believe that what has been proposed is very much in line with the provincial framework. And I think that as a matter of practice, of professional practice, as public health practitioners, we're obliged to follow the data and do what makes sense to best protect the health of the populations that we serve. So as I mentioned earlier, in answer to an earlier question, this is not that dissimilar from what we see in clinical care. There are standard approaches to managing any medical condition. However, how it applies and the timing with which those standard approaches apply vary from patient to patient. That's no different in the realm of public health practice. Each community, as we've seen in this COVID-19 outbreak, has actually had a different experience. And I think we need to respect that experience if we are to be able to provide the best protection for the health of the residents that we serve.
Okay, thank you. Next question is to Raphael Guillemette from Radio Canada. Raphael? Raphael, you there? Okay, we'll come back to you. Next, we'll go to Kate Allen from the Toronto Star. Kate, go ahead.
Thanks. This is a question for Dr. Davila. The city has been collecting individual level socioeconomic and race-based data for a few weeks now, if I'm not mistaken. Has any of that data helped offer more granular insight into why some of these neighborhoods are experiencing a higher burden of COVID-19?
I think we're still in early stages, Kate, with respect to our analyses on those data. We certainly are collecting data and following up and trying to accumulate enough data so that we have enough to work with. I don't think we're at the stage quite yet where we can suggest that we're ready to have that influence our actions, but once that we have enough data collected and we're able to discern particular conclusions or understand different aspects, then we will go ahead and use those data to help guide our action. That's the purpose of having them in the first place.
Just as a follow-up, so you mentioned the term social determinants of health, but since that term's just a little academic maybe for some of our readers, I'm wondering if you can break it down a little more. So why would some marginalized neighborhoods be experiencing a higher burden of COVID-19?
Well, I think that when it comes to any illness, and that includes infectious disease, there are a number of factors that are involved that actually predispose or make some people more likely to acquire certain infections than others. And those are called the social determinants of health. There are a number of factors that influence health, and people tend to think about access to health care as an important one, and that is an important one. But we know when we're looking at overall health, things like income, things like access to housing, things like employment, these are important factors that drive a lot of what makes somebody healthy or relatively unhealthy. So for example, let's look at housing. Clearly, if you're underhoused, there are all kinds of challenges associated with, for example, in COVID-19, how best to affect isolation. You know, if you're underhoused, it's usually tied with income. How do you access protective devices and for example, like masks or face coverings? These are the kinds of issues that actually impact on the ability of individuals and populations to experience good health. So those are just a few examples. I don't want to get into a giant lecture, but those are the kinds of things that we look at and that we seek to try to adjust or to have impact on in a positive way. So in the case of COVID-19, what we might be looking at are things like providing information and ensuring that people have information in a way that they're able to absorb it and actually make use of it. Sometimes it's as simple as language. The other thing we can do, of course, is to provide testing and make testing more accessible to those who have symptoms if for some reason they're not able to access testing. Those are some of the short-term actions we can take to help support populations who are differentially or more impacted by COVID-19. On a longer-term basis, when we're looking at broader health circumstances, as indicated by the mayor, we are looking at other elements, things like income, things like housing, things like employment and employment standards. These have longer-term health impact, and they will absolutely improve health in all regards, whether we're talking about chronic disease or infectious or communicable diseases like COVID-19.
Okay, we'll try again with Raphael Guillemette from Radio Canada. Raphael, are you there? Unmute yourself, Raphael. Maybe try that. One more time. You there? Okay, I'm sorry, Raphael, I guess not. You can send us your questions by email, and we'll try and get them answered for you. That was the last question. Just a reminder for everybody, tomorrow City Council meets virtually starting at 9:30 a.m. and can be viewed on the city's YouTube channel. The next media briefing on COVID-19 will be Friday at 3:45 p.m. Thank you.